order, Senate Health and Human Services, and appreciate your presence. Sorry for getting started a little bit late here. I always like to blame somebody, so we'll blame the Chair of Higher Education for going a little bit long. So that's my story, and I'm sticking to it. Senator Orrick, if you can pray for us and help us with the Lord. Thank you.
Thank you. Let's bow our heads in prayer. We lift our hearts in prayer to the higher power that knows all. We ask for guidance and wisdom as we deliberate as a committee on issues of vital importance to those who sent us here to work on their behalf. We thank you for the opportunity to come together, combine our voices and our minds, honor those who have brought legislation to us, and honor those who sent us here, and pray for guidance, for outcomes that will work in the best interest of all. We ask these things in thy name. Amen.
Thank you, Senator Orrick, for those prayerful words. We have two bills today, and I'm going to use the chairman's discretion. Senator Kirkpatrick, Chair Kirkpatrick, has another bill, another presentation at another meeting. So I apologize, Dr. Burke. He was, I think, first on the list, but we're going to hold him till after Kirkpatrick. So if you'd like to present from there, that's perfectly fine, and the floor is yours. Let me just for the committee's sake, we did have late arriving substitutes. Both bills are in your folders because I wanted you to be able, because they're strictly speaking of our rules, supposed to be 24 hours ahead, but chairman's discretion here. There are only minor changes in the bill, so I put both bills, the original bill and the substitute. You'll see there's only one or two. Both authors will go through that and see there's only minor changes, but I just want to be upfront about that, and the floor is yours. Thank you.
Thank you, Mr. Chair. The bill that I'm going to be talking about is LC 33-8974S. That's the substitute bill. And this bill actually came from the Board of Healthcare Workforce, and I have to be sad for a moment about the loss of LaShawn Hughes, who was the head of not only the Workforce Board but also the Medical Board, and she died suddenly several months ago, and she's going to be tough to replace, and we miss her. So she started this bill, working on this bill with me. What this bill does, it cleans up something that's wrong in the language about who accredits our residency programs. The organization that accredits our residency programs is the ACGME, not the AMA. So the AMA was in the law before. I guess by mistake I wasn't here when that was put in, but it should read ACGME. The other thing that this bill does is it redefines a teaching hospital. And the reason that we're trying to do that is we have several residency programs around the state that are accredited programs that have less than 50 residents. And in smaller hospitals that have residency programs, especially in rural Georgia, we need to be able to have our residency programs take advantage of whatever additional funding they can get from the Department of Community Health and so on. And so we just need to change that language so that we're not requiring programs as long as they have another residency program and access to an emergency room 24 hours. It doesn't matter the minimum size. And I went and looked again at the ACGME website, and they do not have a minimum size that they use to accredit residency. So we just need to bring our Georgia law up to date. I think it's a pretty simple bill, and if anybody has any questions, I'd be happy to answer them.
Do we have any questions from the committee? Seeing none, we don't have anybody signed up for this one. We got several signed up for the next bill. I'll be happy to entertain a motion. Got a motion from Dupass, from Senator Burke, and second from Senator Kennedy. Any further discussion? If not, all those in favor say aye. All those opposed, like sign. Passes unanimously. Thank you, Senator Kirkpatrick, and you can exit stage left. Stage right, actually, I guess, isn't it? Okay, so Senator Burke, we do have several that have signed up, 1, 2, 3, 4, about 5 people. And then we do have a brief presentation after you're finished, so I just want to give the committee a heads up. Senator Burke, I will tell you ahead of time, I think this is one of the most important pieces of legislation that we do in this session, and I think we all recognize that. I think the governor, recognized that, and certainly you being OBGYN, you recognize that, and this committee recognizes that, and the floor is yours. You're on mic number 2. Thank you.
Thank you, Chairman Watson, and thank you for the work you've done to assist me. I will. In my committee today, I've stressed brevity, and I'm not one to chat on, but I do want to give a little bit of background. One of the first bills that I worked on when I got to the Senate was a bill to codify the maternal mortality committee that we passed. I believe it was in 2014, and that committee went to work and have been giving us information and data from all of the chart reviews that they've done through the years on maternal deaths in Georgia, and initially they found many problems, such as 90-year-old males dying of cancer being listed under a maternal death, and so there was a lot of data problems, and so they've spent several years cleaning that up, and then we've with the help of the Governor Deal and Governor Kemp, we've given the committee more resources, funding, so that they could hire more folks to do this work, because it's so tedious. And they are catching up, and I think, from what I understand, by the end of this year they will actually be kind of up to date with their evaluation of all these maternal deaths. And all of you in this room know that Georgia ranks very low in the country, in that we have more maternal deaths than most other states. And but the good part is we have recognized that and have put a lot of work into it, and especially in the budget we've passed grants for rural hospitals that do obstetrics to try to increase the professionalism of the staff. I know our hospital participated in that, and I know it made a big difference. And again, I just want to make sure that everybody understands that this committee understands the problem and has committed to doing the work to improve this situation on both sides of the aisle. And I want to thank my colleagues. It's nice to come into a meeting like this and have people say thank you from both sides of the aisle. And it's not me. This is way bigger than me. And I want to thank every advocate that's passionate about this issue. And it is one of the things that's personally gratifying. And again, the governor, put money in the budget to do this, and that meant we didn't have to ask for it or try to find it in our budget process, and that just makes this so much easier to do. And I want to thank him and his staff for recognizing the importance of this. So getting to the bill, the substitute is 8975S, and it basically just says that we're going to extend postpartum care for mothers for 1 year following the date of pregnancy ends. And I've gotten a couple of emails that came in late about changing the word birth to pregnancy ends, and we did make that change after consultation with Department of Community Health. They were perfectly fine with that, and if it makes it more clear for everybody interested to have that language, that's what the substitute did. It just changed the word birth to pregnancy ends on line 16. very short bill. I'm not going to say it's simple because the policy issue is not simple, but I do think it'll make a big difference in the maternal care in the state of Georgia. So be glad to stand for questions, Mr. Chairman.
Certainly. Sometimes short is more powerful, isn't it? So any questions from the committee? If not, we have about a few to testify. Looks like you have no questions, so we'll call up Kai Lindberg. If you would come forward, and Kate Bianga is on board next. Kai, if you would please just come down here. I think we'll be fine unless you feel more comfortable behind the podium, and we'll turn on the mic there. You want to just have a seat and identify yourself and who you're with. Thank you for being here.
Thank you, Chairman. My name is Kai Lindberg, and I have the pleasure of serving as the Executive Director for Healthy Mothers, Healthy Babies Coalition of Georgia. I will keep it brief. I am a mother, and I have the great pleasure of representing tons of organizations and individuals across this state who just thank you, Senator Burke, incredibly for this legislation. It's going to make a real impact for moms across this state, particularly as we know that that postpartum period is when we observe the majority of those maternal deaths. So I just want to re-impress that we are in support of this legislation, and thank you severely for this effort.
Thank you, Ms. Lindberg. Any questions? Thank you so much. Kate Bianga and Polly McKinney's on deck.
Hello, everyone. I'm Kate Boyanga. I'm the Executive Director of the Georgia OBGYN Society. And I echo the comments made by Kai. I thank everyone today for the opportunity to hear this bill, and I speak on support of several groups in support of Senate Bill 338. We know that women are at risk for pregnancy-related maternal and mortality and morbidity throughout the first year after delivery. Extending access to health care coverage to 1 year postpartum can ensure that medical and behavioral health conditions can be managed and treated before becoming progressively severe and or before another pregnancy. The leading causes of maternal death include cardiovascular and coronary conditions, cardiomyopathy, and hemorrhage. More than half of all births in Georgia are covered by Medicaid, and extending the period for postpartum coverage, the state has an opportunity to improve women's health and birth outcomes. Specifically, we believe extending postpartum coverage would reduce maternal mortality, improve maternal health, and promote early detection and treatment of postpartum depression and related mental health conditions. It will also reduce the rate of low birth weight and preterm births, and reduce healthcare costs to the state and support providers delivering care in rural areas. The health of Georgia moms and babies is a crucial priority, and by expanding postpartum Medicaid coverage to a full year, we can improve women's health and birth outcomes. Thank you so much for your consideration, and we urge you to support Senate Bill 338. Thank you so much.
Thank you so much. Any questions at all? Thank you. Polly McKinney and then Jesse Wethington's on deck.
Thank you so much. I'll be even briefer. I'm Polly McKinney, Advocacy Director at Voices for Georgia's Children, and we're in full support of the legislation and especially the amendments. Wonderful, thank you. And I'll just say, you know, a healthy mom makes happy children, so thank you all for your consideration. I'm happy to take any questions.
Thank you so much.
Thank you.
Appreciate it. Mr. Wethington, you're making the rounds today, aren't you? So,
yes, sir.
and Tina Marie Marsden is on deck. So the floor is yours, Ms.
Yes, sir.
Wethington.
Thank you, Mr. Chairman, members of the committee. My name is Jesse Wethington. I'm here before you as the Executive Director of the Georgia Quality Healthcare Association, which is a trade group representing the Medicaid managed care industry, fully in support of SB 338. It's a good bill for the health of the state and will have a positive impact.
Thank you. Appreciate that. We're singing Kumbaya here in this committee too, Senator Burke. All righty. And Miss Tina Marie Marsden.
Yes. Good
Thank you.
afternoon.
The floor is yours. Okay, do you mind just getting that microphone? You can just pull it to
closer.
you there.
Okay, is that good?
I think so.
All right. Good afternoon.
My name is Tina Marie Marsden. I'm a patient advocate and member of the American Heart Association advocacy team. At the age of 28 and 4 months after the birth of my second son, I was diagnosed with postpartum cardiomyopathy, also known as PPCM. Early warning signs during and after my pregnancy were missed in my case. I eventually needed a mechanical heart pump, known as an LVAD, which is a left ventricular assist device, that's to sustain my life. It's connected to me 24/7. I can't take it off, not even a shower. Health problems during pregnancy and postpartum impose a significant economic burden on families, communities, and the health system. Extending Medicaid coverage could potentially mitigate part of this burden by ensuring moms can prevent or treat health issues before becoming progressively worse, like in my case. I recently celebrated 10 years with my mechanical heart pump, which shows a maternal health crisis can have a lifelong impact. Today, many women continue to face dangers, including death due to misdiagnosed and untreated pregnancy-related conditions. As a patient advocate, I have met mothers from Smyrna, Atlanta, Decatur, Fairburn, Griffin, Waycross, Georgia, who each developed postpartum cardiomyopathy. Nearly 70% of women describe at least one physical problem in the first year of the postpartum period. Nearly a third of all pregnancy-related deaths occur between 42 and 365 days postpartum, with the number of maternal deaths attributed to cardiovascular disease being highest during this period as well. That distinctly demonstrates the urgent need for postpartum Medicaid expansion. Access to health care is vital for early diagnosis and treatment of pregnancy-related medical conditions, which is necessary to effectively address the maternal mortality rate. Thank you for addressing this very important issue and allowing me to speak today.
Thank you for sharing your story. Just before you leave there, most of the folks here have some medical background, but the cardiomyopathy for most probably is not fully understood. So if the heart's squeezing 65% of your heart ejection fraction, so it contracts that much. Yours was probably down to 10%, 15%?
It was 26% when I was first diagnosed. I went down to 5% when I got my LVAD.
Yeah.
I couldn't be listed for transplant due to a lung cancer diagnosis. So this was necessary to sustain my life.
So 65 to 26 down to 5%.
Down to 5%.
And now you have the assisted left ventricular, which is the big pump of your heart that's assisted, that helps it contract. And that's what you live with, and you've been living with that for?
I've had a mechanical heart pump for 10 years. I just celebrated 10 years January 6th. I've been living with postpartum cardiomyopathy for 19 years. It'll be 20 years in July.
Wow. So 19 years, that's strong. And yours was onset about how far?
4 months.
4 months postpartum. Postpartum. So maybe would have been covered for the 6 months, but for the year, and then continued. Yeah. Wow. Okay. I just want to make sure everybody sort of understands that. Thank you for sharing your story.
You're welcome.
Thank you.
Thank you.
Any questions at all from the committee? Thank you so much.
Okay. Thank you. They're 19 and 27.
That's right.
Yes.
Wow. That's strong. Got their mama. Thank you. So any further discussion from the committee? Senator Berg, do you have any closing thoughts or?
Well,
yes, sir.
Very briefly, thank you, Mr. Chairman, and thank everyone for testifying. And I know there are several other folks that didn't testify that have told me they're in support of the bill, and I want to thank them. Specifically with cardiomyopathy, the governor has also put in his 23 budget request some money for a pilot program to try to increase the number of women getting echocardiograms that have those risk factors for cardiomyopathy, because the committee does recognize that is one of the leading causes of postpartum maternal death. So hopefully, we will catch more of these cases before they become symptomatic. And I want to thank the OB Society and the Department of Public Health, because that's where that maternal mortality committee sits, and they have a lot of staff members that are involved in that for for the work they're doing, because again, it is making a difference. We're getting data, and then we're making policy decisions based on real world data, and that's the way this should work. So want to give a shout out to the governor again for recognizing that and putting that money in the budget recommendation that he released.
Thank you. Any questions? If not, I'll be happy to recognize a motion. Senator Walker. Have a motion to pass. Thank you for calling out that number. And Senator Orrick, second. Again, any further discussion? All those in favor say aye. Aye. All those opposed, like sign. Passes unanimously. Appreciate that. We do have a thank you, Senator Burke, for that.
Thank you.
We do have a presentation, just a brief presentation. They had said if they would come forward. We have Lynn Durham, Advancing Cancer Care Through Partnership Innovation. I think that's in your folder. Is that right? Everybody has that in their folder, and we have it here on both sides here. And we got the clicker too. Alrighty. Okay, if you just, let me get your microphone on. If you
Yes.
bring that closely to you.
Yes, sir.
And if you just take us through it and introduce yourself, why you're here, and we'll go from there. Thank you.
I will. Thank you so much, Chairman Watson. My name is Lynn Durham. I'm President and CEO of Georgia CORE, the Georgia Center for Oncology Research and Education. A mouthful, but I'm here today to tell you about the investment that Georgia has made in cancer in our state, and also ask you to continue conversations with us as we continue to improve cancer care in Georgia. Make sure my clicker. Let me start out with just a few statistics to get us started. Cancer is the second leading cause of death in our state, accounting for 21% of deaths. 53,000 new cases of cancer expected to be diagnosed this year, and more than 18,000 deaths are expected this year in cancer. We are concerned about delays in screenings and lack of screenings during COVID that will add to this number, because the earlier you find cancers, the better chance of treating it, and people have delayed their screenings. The most prevalent cancers in our state are lung, colorectal, breast, cervical, and prostate. The good news, if there is, about those cancers, all those can be screened for. So the most prevalent cancers can be screened and found early. We just need to put the resources toward finding those cancers early. And we also have over 600,000 cancer survivors in our state. What is Georgia CORE? We were established back in 2003 alongside the Georgia Cancer Coalition. If some of you may have remembered that, it is no longer standing. It dissolved in 2012. But our goal was to bring more clinical trials and more advanced cancer research to Georgia, and to keep Georgians in the state. The leaders at that time didn't want Georgians to have to go to MD Anderson or somewhere outside of the state for the best cancer care in the world. They wanted that to happen right here in Georgia. And so they put the resources to allow us to build that. Georgia CORE has a statewide mission. We work all over the state, and we have a statewide impact. In just under 2 decades, we've had an 8-fold increase in the number of clinical trials in our state. Right now, today, there are more than 800 clinical trials in cancer happening in Georgia, different medical facilities around the state. We've increased access to life-saving care for minority, rural, and underserved populations, and we've improved quality of care for patients and the quality of life for those 647,000 cancer survivors. But we don't do this alone by any means. We are built on partnerships, and we work with the regional cancer coalitions, the Georgia Cancer Control Consortium, and the health systems of our state. So let me tell you just a little bit about this infrastructure that has been built. So the Georgia Cancer Control Consortium is what we call a coalition of the willing. It is volunteers that come together with the guidance of DPH. We do work with DPH and the Georgia Health Policy Center at Georgia State University. More than 100 volunteers work monthly to get together to put together the cancer control plan for our state. This is led by Dr. Jim Hott. Some of you may know him from the Albany Area Primary Health Clinic, and Dr. Brian Rivers from Morehouse School of Medicine. We write 5-year cancer plans. We're in the midst of the current plan from 2019 to 2024 right now. And our goal with this is to save lives, reduce burden, and reduce disparities in cancer outcomes. You see on the slide some of the specifics: increasing HPV vaccinations for boys and girls. Those cause HPV can cause 6 different types of cancer. Enhanced early detection through screening, really get the word out about those most prevalent cancers and how we can screen and find them early. Excellence in diagnosis and treatment of cancers. That means having the best researchers and clinicians in our state. We can't take our foot off the gas when it comes to recruiting and retaining the best in our state. Ensuring statewide access to palliative care once someone has been diagnosed, and improving quality of life for cancer survivors. The next is our regional cancer coalitions. There are 5 regional cancer coalitions in Athens, Albany, Columbus, Rome, and Macon. They were first started to really concentrate on our rural areas, and they certainly still do that. But now those 5 regional coalitions cover every area of our state, urban, suburban, and rural. And they work directly with the patients. They are out there, the boots on the ground is what I always call them. They are working with education, prevention services, access to screening and treatment, smoking cessation, many other areas for cancer. They are independent nonprofits, and they sometimes partner with us, and a great example of that right now is Georgia Corps partnered with Horizons in Albany, Georgia, and with Augusta University on a 5-year, $5 million grant from the CDC to increase the percentage of colorectal cancer screenings in Southwest and Southeast Georgia. So we all work together. Next, our healthcare systems. I couldn't put them all on the slide, but healthcare systems from around the state. Some of you will recognize all of these. This is who we work. Georgia Corps works directly with hospitals. Emory's Winship Cancer Center is the state's only NCI designated cancer center, and they are wonderful partners and leaders. But we also work with others. And Augusta University's Georgia Cancer Center and the Northside Hospital Cancer Institute partner with doctors around the state to bring more NCI, National Cancer Institute, clinical trials to Georgia. So how do we pay for this? We pay with the tobacco funds that you allocate, so you appropriate. Since Georgia and other states sued Big Tobacco back in 1998, you know we get millions of dollars each year in those funds. This year we're at $148 million, I believe, that has been given to Georgia for this. And this was to help ease the burden of all that smoking did for health in Georgia. So we used to, all the prevention and screening and cancer-related activities used to get 27 cents on every dollar when we first started for cancer-related activities. Now we're down to 9 cents on every dollar. We know you have really hard decisions to make when it comes to Medicaid and making sure that that program is getting the funding they need. But we would love to continue discussions with you on how we can take some of those funds and move them more to the prevention and the screening and the education side so we can stop so many late-stage cancers. Will help alleviate the burden of spending on the Medicaid program. We would love to start a legislature advocacy council and get some of you to work with us on that, to help us, to advise us, to let us know how we can work with you to best see if we can make that happen. And lastly, we did this booklet before pandemic, but it's still alive today. It still absolutely holds true. Georgia needs more colorectal cancer screenings. We're at 68% of our eligible population. We need to be over 80%. We have our lung cancer screening rate is only 5.6% of the population that should have it for low-dose CT scans. Unfortunately, that's pretty normal for the U.S. Georgia is not out of line with other states, but we need to do more. More black women die of breast cancer and more black men die of prostate cancer. And we need to make sure we reduce those disparities in there. And then more cervical cancer screenings. The rates of cervical cancer screenings have gone down. Again, that is a completely preventable cancer, and we want to work on that. February is National Cancer Prevention Month, so I thank you so much for allowing me to be here on February 1st to start that. We will be around the Capitol. You'll see us this month giving you stickers and some other things and reminders about screenings because it's so important to do that. But I just want to end by saying, Georgia has invested in one of the best cancer structures in the country, and we need people to be able to stay here in Georgia to get the best cancer care. We urge your support in continuing to provide screenings and prevention and access to care, and we hope you will work with us on that and continue to have conversations to see what we can do to work together to improve it. Thank you so much for having me here today. Yes, ma'am.
Thank you, Ms. Durham. Appreciate that. Senator Art.
Thank you, Mr. Chair. Thanks for that excellent overview. I wanted to drill down a little bit on this tobacco funds.
Yes.
I know that when the funds when the case was won and the funds were allocated, CDC was recommending the Georgia should be spending $60 million a year of that money in order to adequately do the prevention as well as the screenings and so on and so forth. And you talked in pennies, 27 pennies
Yes.
What, in 2020 and what,
9 now.
Nine
Yes,
now. That means that we're redirecting funds that are coming from the tobacco settlement and spending them in other parts of the budget as opposed to spending them in
Yes, ma'am.
trying to grapple with the cancer numbers that we have.
Yes, and most of that is going to Medicaid, and I don't know if that's not all for cancer treatment of Medicaid, but most of those have been funneled more toward Medicaid and less toward prevention.
Yeah,
so we're only spending about 14 million, of that right now. I believe that's what it is on the prevention side.
Yeah, I mean, I think that all of it, if I remember correctly, all of it goes to health care.
Healthcare, yes.
Well, I know there was just great statistics back in the day when the states got this money and they started robust programs, Florida being an example, and in 3 years on the prevention end and messaging particularly to these young people before they get hooked. I was one of them. That the data showed that it dropped by 3% in 3 years among this cohort of these teens that don't start smoking. It changed the numbers by doing by investing. It really works. The preventive messages work.
And we're very worried about vaping right now because 16.3% I think is the last data we have of adults, Georgia adults smoke, but 21% of students, and we believe that's kind of low, 21% of high school students vape. And so we're worried that that is not changing. The regional cancer coalitions work very much on some smoking cessation and other areas, but they need additional resources to help
so
with
we're
that.
at 60. Yeah, I mean, that is sort of phenomenal. I mean, I hate to, show my age here, but I'm happy to do it. I mean, back in the 60s, right, when the Surgeon General reported it. Does anybody remember what the number was of the U.S. population that smoked? I might remember it was over 50%, right?
That's
right.
We were
And
sitting
if
in
I remember
cars with
correctly,
our
I'm
daddy
gonna,
smoking.
I'm gonna throw the. Certain professions in healthcare, I won't throw any particular profession, was higher. It was like way over 50%, close to 60, maybe closer to 70%. And I think physicians were around 55%. But now, I think healthcare is markedly reduced. I think healthcare workers are maybe less than 5%, and I think that you said the general population is 16%, and that's in Georgia.
Yes, in Georgia.
16% in Georgia, and so I mean, just a few years ago it was 25, 26% or
It's
so.
worked.
But having said that, that's still a significant addiction, and that's still, if you look at the common cancers, obviously lung cancer is a major determinant, and breast cancer also as a risk factor there. I'm not aware of colorectal cancer being maybe a minor player there. It is an carcinoma, so it's
Bladder.
a type.
You said
Bladder is, along with alcohol. I don't want to say that amongst this committee by any means, but that's not one of the most frequent cancers. Prostate cancer is up there too. But listen, I want to thank you for coming. Thank you for being here. Thank you for what you do. Is any other questions or concerns? Looks like Senator Walker has something on his mind there.
I think there was an article in the Atlanta paper in the last couple of days that smoking had actually increased, especially with young people in the first time in decades. And they attributed some of it to the pandemic somehow. I guess the pandemic's responsible for everything, but I'm afraid that there's still a lot of work to be done, I guess, on the education side of that.
Yes, sir. We
Thank
would
you,
love
Dan.
to continue conversations with you to see what we can do to help that.
Thank you. We
Thank you.
appreciate that. If not, I'm sorry. Majority Leader, Minority Leader.
Mr. Chairman, I'd just like to say that this has been the best meeting ever. We've passed 2 good bills, a great report on an issue that is killing us by many numbers, and I really appreciate what we've done here today.
Thank you. I appreciate you pointing that out, and I think we shouldn't have any other comment after that. So let's have the meeting adjourned.